Okay.
John Rubino stood in line at Bloodworks in Seattle first thing in the morning on the first week of December to mark a milestone.
That's me.
Rubino is gay, and being so had barred him from donating the blood he so eagerly wanted to give until now. But it was a long time coming for him. Some years ago, during the height of the pandemic, Rubino wanted to give his plasma, but he was turned away.
It's discriminatory, so it's been a little bit of a pain in the neck for me, who, especially when I had COVID and wanted to donate my convalescent plasma and was denied, it was gut-wrenching.
He was denied because of an old FDA policy to reduce the risk of transfusion-transmitted HIV that restricted sexually active gay men from donating blood. But in May this year, the FDA got rid of eligibility questions specific to that group and changed them to individual-based questions regardless of sexual orientation.
I was around in the 80s in the, sort of the beginning of the AIDS crisis. And this, to me, just feels like that history that I have is just being lifted off of my back.
It was a relief for blood banks, too. The American Red Cross implemented the changes in August, and this month, Bloodworks started them.
And we love getting away from a social criterion and moving toward one that's based on individual behavior.
Bloodworks co-chief medical officer Dr. Kirsten Alcorn adds any additions to the donor pool are welcomed and encouraged.
What we always worry about is that there could come a time, completely unpredictably, when the need for blood could be higher than the supply. And we don't want anybody who needs blood to go without.
But on this important moment, a temporary setback for Rubino as he found out during pre-screening that his iron levels were too high to donate that day.
I couldn't donate today. Apparently one of my numbers was off that they check on, but I've got my little piece of paper. I'm going to be coming back.
Because he knows the need is great.
The LGBTQ+ community in Seattle is pretty big. So if we can get a percentage of that population now donating blood, I think it'll make a difference.
In Seattle, for HealthLin, I'm Christine Payne.